This is Module 4, Monitoring Blood Sugar, Food is Medicine Curriculum. Presentation Overview. Today we will be discussing the benefits of checking blood sugar, different ways of checking blood sugars, blood sugar targets, and hypoglycemia and hyperglycemia. This picture is a good depiction of what we have to deal with and think about with diabetes. So there's a lot of things to juggle and manage and monitor, and sometimes it can feel overwhelming, and trying to do everything all at once is too much. So I feel like this picture shows that, we have to check our blood sugars and all the different times we can check our blood sugars. If we're taking insulin, or we're trying to be mindful of our carbohydrates, trying to count our carbohydrates, trying to get a walk in. If you have to give yourself an insulin or an injectable medication, giving yourself a shot, remembering to take your medications, checking your portion size, looking at labels, drinking water, understanding how to treat a high blood sugar or a low blood sugar, and then also finding time to sleep and find activities that can be relaxing and calming. So it can feel overwhelming to manage diabetes sometimes, and so you have to give yourself a little bit of grace, and also just making small changes a little bit at a time can end up to be quite a large change over time. So not getting yourself too upset if you can't monitor all these things at once. So the benefits of checking your blood sugar. It's a primary tool that can show you where your blood sugars are at any given time and whether you are in your target range. So you'd only know what your blood sugar level is unless you check it. Checking your blood sugars after meals allows you to see what you ate, how you ate, what you ate affects your blood sugar. You can better manage your diabetes if you know where your blood sugar levels are. For example, adjusting how many carbohydrates you eat at a meal or a snack based on your blood sugar level, and adjusting how much insulin you give yourself, or the timing and duration of your physical activity based on your blood sugar. It's important for your blood sugars to stay in a healthy range. So if your blood sugars get too low, you might have difficulty thinking and functioning normally. If your blood sugars get too high, there can be damage and risk of long-term complications over many years. It's also important to record your blood sugars in a logbook or an app. That way, when you go in for your doctor's appointments, you can share it with your provider or care team so they can help make better decisions for your treatment and care based on your blood sugars. And here's an example of a blood glucose journal that we can provide you. You can write down what your blood sugars are before and after you eat, if that's when you check them, before bedtime. And then you can also make comments depending on maybe what you ate that day, or if you were sick or stressed. So we do have some tools that we can provide you to record your blood sugars, or you can always use a smartphone app as well. So there's different ways to check your blood sugar. You have the A1C test, blood glucose monitor, and continuous glucose monitoring, or CGM. The A1C test is a blood test that measures your average blood glucose levels over 3 months. So this is a common test that's used to diagnose for prediabetes and diabetes. It's also the main test your provider and care team use to help manage your diabetes better. The A1C target for most people with diabetes is less than 7% or 7% or less. And your provider can always provide you with a more individual target based on your age, your length of diabetes, and if you have any other comorbidities. Your blood glucose monitor is an at-home blood glucose test that you use to check your blood glucose at various times of the day as needed. So times when you might want to check your blood sugars are fasting, so before you eat or drink anything, before meals, 2 hours after meals, before bedtime, before and or after physical activity, when feeling low blood sugar, or when feeling sick. Checking and logging your blood sugars at home allows you to see how diet, exercise, illness, or stress can affect your blood sugar. So all those different times that you can check your blood sugar, you don't have to do all those times every day. Sometimes varying every day when you check your blood sugar allows you to see where your blood sugar is at different times of the day without feeling overwhelmed with checking your blood sugar. And continuous glucose monitoring, or CGM, is a device that measures your blood sugar every few minutes using a sensor that's inserted under the skin. And usually there's a transmitter as part of the device that sends the blood sugar readings wirelessly to a receiver or smartphone app. So the CGM device allows you to continuously or intermittently see where your blood sugar readings are depending on the device. So wearing a CGM cuts down on the number of finger sticks you have to do, and in some cases eliminates them altogether. CGM devices also allow you to download a report and send your CGM blood sugar results to your provider and care team. So it's a very convenient thing for patients to be able to see what their blood sugars are anytime without having to use a finger stick all the time. And also it really helps the provider get a better idea of what your blood sugars are doing on a more continuous basis. Most insurance companies cover CGM for patients with type 1 diabetes. Patients with type 2 diabetes have to meet certain qualifications based on their company, but it's more widely accepted now. We still have a ways to go with insurance, but it's definitely improving their coverage for CGM. So general blood sugar targets for non-pregnant adults. You want your fasting blood sugar, so before you eat or drink anything for the day, to be between 80 and 130. Pre-meal blood sugar between 80 and 130, so before you eat. 2 hours after eating, less than 180. And before bedtime, 90 to 150. And again, these are generalized targets. Your provider will always can give you a more specific target range if needed. So hypoglycemia, or low blood sugar, is when your blood sugar reads less than 70. So hypoglycemia can be dangerous if it's prolonged and severe. Low blood sugar, it can cause seizures, loss of consciousness, or death. So in the picture here you see it's important to know sometimes what the signs and symptoms of hypoglycemia are. So you could be sweaty. A lot of times people are shaky, dizzy, confused. You can be grumpy, hungry, have a headache. So you're just not feeling right. Maybe you haven't ate in a while. So it's important to treat hypoglycemia as soon as you know that you're in low blood sugar. First testing your blood sugar, and then simply eating 15 grams of simple sugar. So that could be 4 glucose tabs, 4 ounces of juice or regular soda, or 4 pieces of hard candy. So whatever you eat, you want to make sure it's a simple sugar, it doesn't have a protein or fat with it, so you can get that quick sugar into your bloodstream. Then you wait 15 minutes, you check your blood sugar again, and then you repeat the step above until your blood sugar gets back to 70 or below or above. You want to have a snack, a carb, and a protein if your next meal is an hour or more away. Otherwise, go ahead and eat your meal. Hyperglycemia, or high blood sugar, That happens when your blood sugar is above your target level or over 180. So causes of high blood sugar could be skipping a dose of insulin or diabetes medication, eating more than usual, maybe having a decrease in your physical activity, or if you're under stress or have an acute illness. Signs and symptoms of high blood sugar include feeling very tired, thirsty, increase in urination, blurry vision, sleepy, very hungry, and healings or infections healing slower than normal. So one quick way to lower your blood sugar if it's a little high is to try to drink a glass of water and or go for a brisk walk. And this last slide here just provides a nice visual of what are some signs and symptoms of high blood sugar. So having a stomach pain or cramp, nausea, vomiting, blurry vision, being very thirsty, having a dry mouth, being very hungry, unusual weight loss, needing to pee more, feeling very tired, or if it's high blood sugar for a prolonged amount of time, you might also have a sweet, fruity breath.